intensely itchy rash all over the body or itching more in the night, this could be scabies. Hi everyone, in today's video, I am going to talk about scabies and everything you need to know about this infectious disease. What is scabies? Scabies is a contagious infection caused by parasite Sarcoptes scabii, and the most common way one could catch scabies is by person-to-person contact. Since the infection spreads very quickly, it is more common in people staying in close proximity, so areas where a lot of people are staying together, so infection can spread in school children or in prisoners, or when one family member is infected, he can spread infection to other family members also. The second way one could catch this infection is by using infected linen, towels, bed sheets. So it is also common in areas, in places like hotel rooms or hospital rooms who do not use disposable sheets. Also, it is more common in people who are not very hygiene conscious. Now let's talk about the signs and symptoms of scabies. So intensely itchy rash all over the body or on areas where this mite stays, so between the fingers or toes, below the breast, private parts, buttocks, lower abdomen, these are the areas that are more commonly infected. And this kind of rash and itching that is more common in the night is the most common symptom of scabies. In children, the scabies rash may be slightly different. It may also happen on the face or palms and soles. Now let's see the different variants of scabies. The most common type of scabies is the typical scabies that we just discussed. The second common variant is nodular scabies, where the infected person may develop nodules or lumps, and especially on the private parts, on the genitals. The third variant of scabies is Norwegian scabies or crusted scabies, which is very uncommon and more common in people who are immunocompromised, people on chemotherapy, HIV positive patients, or people who are on steroid medications. Now, how do we treat scabies? Since scabies is an endemic infection present in human beings since thousands of years, there are a lot of creams and gels and ointments and lotions available. Remember to apply the lotion all over the body in the night and then leave it overnight. You have to apply the lotion on areas which do not have the itchy rash also. So every place, every part of your body should be covered with this lotion. Massage the lotion inside, leave it overnight, and then take bath the next day morning. Also, it is equally important to reapply the lotion after a week, and this is because this particular mite that causes scabies will lay eggs, and the eggs then hatch in a week's time, and then they become mature mites, and which is why it is important to treat the mites again with the same lotion after a week. Now, if somebody has a lot of infection, your dermatologist will also recommend certain oral medications to kill the mite, and antibiotics if there is some infection associated with this, anti-allergics, antihistamines to prevent itching. Mild steroid creams also may be prescribed for the first few days to reduce the intense itching and inflammation. Now, how do you prevent recurrences? Since recurrences are very common in scabies, each one of this instruction is very important. Number 1, boil all your clothes in boiling water and let the clothes remain in boiling water till the temperature comes down to normal. This includes all clothes, beddings, towels, bed sheets, undergarments, and for clothes that cannot be put in boiling water, remember to keep them in very high temperature under the sun or warm temperature for at least 10 to 30 minutes. Since different skin rashes and infections may manifest in a different way, it is important to get your skin rash diagnosed, examined, and treated by a qualified and experienced dermatologist. I hope the video was informative. For more such informative content on skin and hair, please subscribe to our YouTube channel and follow us on Instagram. Thanks for watching.